Hi, this is Shweta Somo, Director of Mind Reader. I have my guest Mari Kibblewhite here with me, and I'm going to answer some of his questions related to trauma and recovery. And we may focus today on childhood trauma if the time allows. Hi, Mari. Welcome to the podcast.
Thank you, Shweta. It's always a pleasure to have the opportunity to join you on your podcast and discuss these mental health issues, becoming more and more knowing. I'm sorry, I'm setting myself here. There's a greater awareness of them now. So people like you explaining these to normal people like myself and the other listeners, it's greatly appreciated.
Yeah.
So we decided to discuss trauma.
Yeah, that's all.
The first question that I would like to ask is, how do you define trauma? Before you answer, can I just make the point to the others who may be listening? You once said to me that in your observation, many, I think you might have even given me a percentage, but many people who have mental health issues have it as a result of having a traumatic event happening in their life. And you almost indicate that everybody has a traumatic event in their life. So it's a very important subject, but I don't know quite what trauma means. So I'd be grateful if you could explain it, please.
Yeah, Mari, this is a very sensitive and serious topic as well. Trauma is an emotional and psychological response to a deeply distressing or life threatening event, and it overwhelms your ability to cope and can affect your mental, emotional, and physical health all at the same time. Common causes include accidents, abuse, violence, natural disaster, and prolonged stress. Trauma is not the event itself, it's the lasting impact on your nervous system and sense of safety. So that's the exact definition of trauma.
So it's a negative event that happens in your life.
Yes.
So what, thank you for that, it's quite involved. What, are there any different types of trauma? You highlighted some. Could you explain some of those examples that you said, please?
Yeah, I'll explain some symptoms of trauma and then I'll explain the types of trauma. So, talking about the symptoms, common symptoms are physical, emotional, cognitive, and related to the behavior. So, when we talk about the physical effects of trauma, it can be fatigue, headaches, muscle tensions, digestive issues. Emotional symptoms could be anxiety, anger, sadness, irritability, numbness. And talking about the cognitive symptoms of trauma, it could be difficulty concentrating, intrusive thoughts, or a mental fog. And coming down to behavior symptoms, it is like social withdrawal, avoidance of reminders, substance use, and the most common symptom that I've seen is people are unable to sleep and they have really bad dreams all the time. For example, if someone has a traumatic event at the workplace or there is a very scary boss, the people working there always dream about that boss at night, and they just keep dreaming about the work and the boss and stressful situations. So that is the extent where the trauma triggers, like it disturbs your sleep and it really affects in all ways. When we talk about the types of trauma, it is acute trauma, which can be from a single event like accident or assault. There is chronic trauma from repeated exposure to bullying or domestic violence. So when I talk about bullying, I would like to focus really on bullying in schools, especially in that age when children are very young. That really affects them and causes chronic trauma. Third one is the complex trauma, which is multiple traumatic events, often interpersonal, like someone getting pulled up for their dressing sense maybe or manners, and usually these things happen at workplace. It doesn't happen mainly in the young age, but in the senior positions, when there are boss and staff events, and that is usually this situation, which is very complex. Secondary serious trauma experienced by those close to trauma survivors. For example, if we live with someone with mental health issues or someone who has a trauma and the family suffers a lot due to their trauma, and which always happens in the case of mental health as well. If one of the family members is having the mental health issues, all others suffer too. And it's sorry to say that, if children are involved there, they experience the trauma for no reasons, but that's life. Now, the last one is developmental trauma, which occurs during childhood, affecting attachment and emotional regulation. The best example here is, parents separating when the kids are under 9. It really gives a big trauma to children because they are very young to tolerate or accept that situation, that someone is going away from them. That is real traumatic. Yeah, so these are types of trauma.
Okay. That's a lot to cover there. The last one there, I've experienced or been involved in myself. I don't want to blame anybody, but my first wife and I split after 7 years, and we had 2 children, one 5 and one 3. And I'm very pleased to say that they didn't seem to suffer any trauma because my ex-wife remarried quickly with a very nice man who became the stepfather, and they've had a very good upbringing and don't seem to have suffered in any way. So I'm very pleased that we avoided that. But I can understand the children being upset by the splitting up of the parents. The other one I wanted to talk about was, I'll ask your opinion on, in the case of bullying in schools, is it possible that both children are suffering trauma? The bully is traumatized because of something that's happened in his home and is taking out his frustration on other children, and the child that's being bullied is being traumatized by the bullying act, so that both children are being traumatized. Is that possible?
Yeah, that's absolutely correct. And you have already answered your question. So, one child facing bullying at home from the parents or watching something going on in his family creates the same trauma for the students, other students in the school, and the other students have to suffer that trauma. So, that's how the trauma chain works. It is also a part of developmental trauma, but you are exactly right when you say that a child who is being bullied at home or who watches bullying in the house is the one who goes outside in the school or society and starts bullying other people. So, bullying starts from home. People believe it or not, but that is true.
And I'm slightly aside that raises the issue about if bullying starts at home. What is there anything happening in Australia or New Zealand or wherever in the world where the families are trained to be normal, for want of a better term, realise that they may be affecting their children by their actions at all?
Yeah, I can answer that in detail. So all the schools have a mental health team who look after the mental health of the children. When children show these symptoms, they immediately talk to the parents and notify the parents about the bullying behavior to both the parties, the one who is bullying and the other one who is suffering both. So that is the first step where the school tries to notify the family that your child is bullying others. So that is the first hint for the parents to understand that why he's doing that, because he has seen something in the house. So that is the first window for the family to consider change in their lifestyle and how they talk and how they behave. What happens next is, if that continues, there is an investigation in the families. They go to their house and they talk with them. They try to find out what is happening. They have personal sessions with the children as well. or they are referred to ndis or psychologists to see what is going on. So things come up, but there are some cases where one parent is aggressive and another parent is not. I've seen this in most cases. The father has got anger issues which directly comes to the children, and that is where the suffering starts. So, but I've seen like 70% of the cases when parents see the children suffering or bullying outside, they actually change for the better of their children. So that's how these things are managed, and school actively participates in these things.
Well, that's good to hear that the schools have got those programs in place now. That's very good. Are there any indications that the child might be acting as if they've suffered a trauma, but they actually haven't? Is something else? Is there possibly of some confusion or
Yeah, what happens? Yes, I know. The children actually, children, if you have noticed, most of the children, they just try to copy what the elders are doing. So if there is a dramatic parent who is totally fine but acting as if he's upset, then the child just copies that thing, and that's how they behave. So they are just copying their parent and showing as if, oh, I'm very upset, I'm angry, and etc. etc. But actually, they are not, because this is just the dramatic nature of a parent, one of the parents. So these are the situations where they look traumatic, but they are not. Sometimes children lie, and there are children who most of the time create miscommunication between the school and the family as well. But the family and the school get together, and they discuss things, and they discover that the child is lying about certain things. So there are cases which look like trauma, but they are not. It is just the behavior or nature of one or both parents that shapes the behavior of the children.
yeah. It reminds me of one of my ex-neighbours who had lived with his wife some years, and the child had been with his wife, but she was still on drugs, and he just chose to have his son come and live with him. But they had great difficulties relating well, and his son would, and from my neighbour's point of view, his son would not tell the truth. And he actually, and this is the question I'm getting to, what happens if you become aware that there's a traumatic issue with your children and you're not able to overcome it yourself, even with professional advice?
Yeah, so yeah.
You, you,
So parents, I don't know how educated all the parents are, but school is always the one supporting the well-being of the child and the one to give suggestions or referrals for children's behavior support, psychological support, or psychiatrist support. So they are the one to write the referral letters to parents that maybe your child needs this, maybe they need talk therapy, or they need occupational therapy, they need a behavior support, or they need a psychologist. So school is actively helping the parents. And secondly, if parents are well aware of what mental health is, they also take necessary steps to connect their children with the right institutions or providers so that their children can improve. So children are taken care of by the schools, and if the children go to school, a school is always diverting. But what happens is sometimes the parents fail to obey the instructions from the school, and this ruins the career and future of the children. So it's very necessary for the parents to take all the suggestions from the school principals for improvement, because I've seen the Melbourne schools are actively working on children's behavior, and they take care of them like a family. So if parents are not following the instructions or suggestions from the school, it may just delay the development of their children, and that's where all the mental health problems start, because some parents think that if schools are like, they don't take the schools seriously, they just want to ignore what schools are talking about their children. They are so confident in their upbringing, but when the children turn like 13, 14, the parents actually start worrying, and they take all the actions, and it's too late at that point. because the personality has already built up. So the quicker they take action, the better. And I've seen children suffering with loneliness, behavior issues. I've got a lot of clients from India, yes, where parents are struggling with the behavior issues of the children, not listening, not studying, trying to stay lonely, not interested in working, lazy. So all those things happen because the children are not being taken care of by parents when they are in school, and ignoring the school's referrals and suggestions is really not good for any children futures.
Yes, indeed. Now, what about the situation where there's a solo parent? Got one, or hopefully not more than that, but got some one or two children, and they're looking after them there.
So, in Australia, if there is a single parent, they have a lot of support from the school, and there is 1 or 2 days in the week where there are school committees who talk with them. Do you need any support? So they can call the school mental health team or the well-being team that I'm suffering with this. If they need some sort of help, there is also help available for them to be supported at home, but it is only for Australian citizens. It's not for others who are not citizens yet. And there are a lot of community groups who actively support the families who need help. Like, I'm associated with 27 churches in Melbourne, Australia, where the church group looks after the children after they finish their school until their parents finish their work and come home. So these are the parents who cannot afford the daycare, and they are single parents, so there is no family. So communities like this, and especially the church, they are very, very supportive. I've got like over 50 clients in Melbourne CBD for NDIS where they are not offered food on the weekend. So I connect them with these church communities, and we arrange the food packages for them for the weekend as well. So I work with a team of pastors and, all that team who is the social organizing team, the youth team. So we collectively work and we deliver these things for them. So there is a lot of community support. They just need to know that. And if anyone is not aware in Australia, like where to go, I'm always there to help them. My website is on my picture. It is happiertherapies.com.
Very good. I'm pleased you have managed to link in with the churches. It's very important that children be given their support when they're so young. Well, we're getting close to the end of the questions I have. The one I wanted to know is there any way of seeing evidence of that the child has overcome a traumatic issue at all? Is there any way you can tell that?
Yes. I'll first discuss the therapies which are used to overcome the trauma. First one is the cognitive behavior therapy, which challenges negative beliefs tied to the trauma. Second one is the prolonged exposure therapy, which safely confronts trauma related memories. There is somatic therapy, focuses on body sensations to release stored trauma. There is special trauma focused CBT, which combines cognitive techniques with trauma sensitive interventions. And then there is mindfulness and self care, which is yoga, breathing exercises, journaling, and social support. Now, I've got between 13 and 15 clients who are like between 5 and 13 years of age, and I give them hypnotherapy sessions. I also record, there is a sleep therapy where we record the audios and we play it after the baby goes to sleep. So after children go to sleep, 30 minutes after that, you play that 10 to 15 minutes audio, and I personalize these audios for the situation of that particular child, and that really helps. It's called sleep therapy. That is also a great option for the children. Now, how do we know trauma is gone? So for that, there are some signs of healing which include reduced emotional triggers, reduced flashbacks, improved emotional regulation, inability to pause before reacting, physical relaxation, and feeling safe, connected, and able to trust again, and greater self awareness and ability to enjoy life without guilt or fear. So it really shows up. And the main thing is people are happy, smiling, not thinking too much negative things. They trust others. These are some of the signs that the trauma is gone. And I daily remind all my clients that take care of your sleeping habits, sleeping patterns, because a good sleep means everything.
Very good. I'm pleased that there's signs. But who actually sees these signs? Is it something that's done by the teacher, or is it just your clients?
I think it is up to the clients and their families to observe. But when I talk with my clients, I actually these things with them that how did you eat? Did you eat well last week? Did you sleep properly? Did you take the right medications? Has something happened in the last week that has disturbed you? Have you had any scary dreams last week? Are you feeling overburdened? Are you feeling upset or stressed? And I've got like a set of like 15, 20 questions that I ask everyone before I start my meeting.
Good. It's a very good system you've got, in my opinion.
Yeah.
Check.
Yeah. So first 10 minutes, I'll just check with my clients. And then I have the therapy session for 40 minutes. So it takes like 50 minutes. And then I give them 10 more minutes to ask me any question. So it is 1 hour session. And surprisingly, clients that never talk with their family, they talk with me.
It's also interesting that you've given them time to talk, whereas if they went to, and I'm not pointing the finger at anybody particularly, but my observation of doctors that are inclined to be very concerned about keeping everything into 5 or 10 minute sessions so they get through to see the next client rather than giving quality time and extending the time period to help your patient fully by doing these assessments. So I'm pleased that you've got in my mind, a better approach.
So I look after my clients just like my family. All my clients are allowed to call me, message me anytime they have a problem. And there is no time limit, nothing. For every session, every 1 hour session, I always allow 30 more minutes in case they want to talk more. So when I schedule my appointments, they are 1.5 hour apart. So that gives that flexibility to my clients to just reflect on how they feel or if they want to talk something more. I take urgent phone calls even at night because there are clients who get sick and I have to arrange some hospital visits for them. So I am 24/7 available for my clients. The phone is always on. Plus, if they are suffering with, like, they are struggling financially and like they are struggling with food or something, I actually take food for them. I work with the church and get the food delivered. So I don't help them financially, obviously, but I help them in all the possible ways, getting them connected to friends, families, getting them connected to the church and like minded people, like from the same countries, who I believe can be good friends. So that's how I keep connected to my clients. Most of my clients refer my services because I take care of their religious beliefs and, the cultural beliefs as well. Like, if my clients want to go to a South Indian temple, I would take them, and none of the other providers do that for the clients. If my client wants to eat a South Indian food, I will arrange that once a week for them and get it delivered. And the others, I haven't seen others doing that. And none of my clients have explained me that these things happen. So I take utmost care of the cultural sensitivity of my clients, and I make sure any of my staff who talk with my clients or work with them, even the GP, psychologist, or therapist, I make sure that my clients are well treated by all of them. If my client has got a complaint with anybody, I immediately change that provider for them.
Very good. You're doing a marvelous job to do all that. Really, on behalf of your clients, thank you for what you've done. It's very helpful and very supportive. And can you just give us perhaps one success story without mentioning anybody's name, but you might be useful for people to hear, especially if it relates to a young person? Have you got anything in mind?
Yeah, I've got 2 to 3 cases where some youth were involved in a conflict with the opposite sex in the schools, and I think some of their pictures were really like circulated, and they got leaked, and there was a lot of trauma around that. I had to actually support that youth with a lot of support letters, get him the right psychologist. I had to talk with police as well because I wanted the things to calm down. I did go and talk to his school principal as well because I was just trying to make sure if that is the right school for that child. Because in that teenage, if the person is struggling, my best advice would be to change the school. But when I spoke to the principal was very accommodating and they were very supportive. So I thought like it's better that that teenager stays in the same school. But I did my best to link that school, their families. The family was actually reluctant to talk to me because the youth was having emotional abuse from the family. So there are situations where it's very complicated sometimes, but I try my best to work with the church, the family, the school, and the healthcare team, which is GPs and psychologists and all that. So I have given my best to all these youth, and they work with me. They call me anytime. I attend their birthday parties. We celebrate events together. So it's like a family for me.
Well, it's fabulous. That's wonderful to hear what your support is. So that's all I've got today, Sweta. It's been a very, very enlightening program for me, and I'm sure to other listeners to hear what you've said and what you do yourself. So thank you so much again.
Yeah, thank you, Mari. I'm happy to answer any of the questions you may have in future as well. And I hope I have answered